So I'm going to walk you through step by step how I build sites. These are stronger graft sites, either difollicular grafts or larger follicular grafts. And I build sort of right close to the hairline, but not exactly, because you want to prioritize. You don't want to run out of hair and make all this dense back here and you got nothing up here. I always hit this hard first, and then I feather back here and less and less and less density. Because if you do the opposite, you start back here, go there, you're screwed if you run out of hair. And then I just go back, interlocking them all the way back. And then I start to interlock the smaller grafts going forward, and I build the hairline forward. If you build the hairline forward, then you can build a hairline that resembles a coast of a shoreline like this. If you build it front to back, the tendency is to make the line too straight. So you don't want the line straight. And I'm going to show you physical examples of my work so you understand what that means. This is just a schematic so you understand what I'm talking about. And then you want to finesse it further. You sit there and you really scrutinize it. You look at it, you go, that's still too straight, that needs a little here. And then you start making these little sentinel hairs that are one hair grafts in front of your one hair row of one hairs to just blend and further. If you look at any natural scalp that's beyond maybe an 18-year-old, you'll see little one hairs sitting in the front. And so you really want to blur this. This should not be a line. And the back side you want to blur as well. Maybe not as aggressively, but you want to blur the back side. So if they have no hair here, you want this to look natural when someone looks from behind at them. This is to show you sites I created for the crown. You can see the whorl pattern. And the key with good hair, this is a really good example, is to show you how everything transitions slowly. You see this? There are no abrupt angle changes. Everything sort of swirls gently. There's no abrupt, sharp changes. Everything flows on a head naturally. If you look at someone that has a full head of hair, you'll see small transitions. This is the hairline here in close magnification. You can see the staggered, and you can see these sentinel hairs, and you can just sort of see, think of a coastline. When you go to a coastline close up, it looks really jaggedy. When you're far away from the coastline, it looks relatively straight. That's the same way that you want to create a hairline. It's like little archipelagos, little pieces of islands floating outward. This is to show you again subtle transitions going into the temporal hair. It just slowly arcs this way. But everything here is straightforward. Another big mistake for junior surgeons is making the hairlines radial. They should be straight, except at the lateral centimeter, where it just starts to arc down into the temple. Big mistake. Make them straight. In fact, what I've been doing, not to make it too complicated, is I actually converge them in a little bit. Because if you think about how the head is shaped like this, if you put them straight like this, the hairs will fall out. You want to protect the forelock and bring them in, bring them inward. Focus on that central forelock. So this is just showing the left temple. If that's orientation, I don't know if that's confusing. The ear sits over here, the left ear. The nose is over here. This is the left temple transition. Again, too complicated to explain to you, but I just want you to see how different this female hairline is. It is a central whorl. You think of the cowlick with a woman. The angles almost go backwards, exactly the opposite of what a male hairline is, with a closed area. Very complicated. You should not be doing female hairlines if you're just starting out, because you're going to make them look like a man. You want to create really pretty results for women. I'll show you some of my results in a second. Okay, here's a video of recipient site creation.
Okay, what we've done is we've marked out the regions. You see the hairline here. What you see in the first line, this is the hairline zone that I'm going to be building principally with 2 hair grafts all the way across here. And as you see the second, the front row of 19 gauge sites so that the one hairs are interlocked and tightly form a barrier to protect against visual show of the 2 hair grafts. But they're also dancing out like sentinel hairs. And you can see the design of the front hairline is very, very natural. It's not too zigzaggy and it's not too straight, which is a difficult balance to strike when you're creating a hairline. This is the art of making a good hairline. You remember that we've got probably about 70 rows of 2 hair grafts are going across here. Those are framed with a deeper gutter of 18 gauge that are covering 3 hair grafts that are just slightly splaying as we go over toward the frontal temporal recession into the temple region. Otherwise, almost all straight going across here. And and then a lot of dilated unit grafts, 16s that go across this entire area with a little bit of tighter distribution here in what's known as the central forelock, as well as the areas here in the penultimate recessions. They open just a little bit as we go down toward the area of his natural existing hairline back here. So this is a good overview of all the site designs, and I think it's important that you see this so that you visually can sort of match up your design work to what you're seeing in this video as sort of a template for where you can strive to achieve an excellent natural result for a gentleman.
Hopefully that was clear for you. What you saw before initially was the macro hairline, how to draw a line. What you saw here was the micro hairline, how to take that line and make it into not a line, how to make the line disappear. So just some results. I've got a lot of results on my website. But you see, you can take a gentleman who's a Norwood 5'6" and make him into a 2'3", you know, and I think that's exciting. With one session, they've done well. You can take a woman in 2 sessions and convert her from a more masculine looking shape with a little hair coloring and make it look much more feminine. In very coarse, straight Asian, some Hispanic hairs, you've got to make sure those angles are low, and the hairline is, you pick the finest grafts for the front hairline so that it looks natural. I want to talk to you about corrective work. I didn't go through a lot of the technical assistant work. That's what the course I have in St. Louis and the second volume goes through. But if you look, what you're seeing here is poor growth, a badly designed hairline. And do you see how these are all kinky? Looks like pubic hair. It's due to the fact that the grafts during insertion were traumatically inserted and the grafts were mishandled. This is a 1-session correction. Besides the very badly designed hairline and no temple match, and it's too straight, the grafts are too large. Also, do you see there's like this little dimple? These little dimples are what's called pitting. At the end of the procedure, the grafts have to sit about 2 millimeters at the skin surface above the surrounding skin. If it's flush or below, you get this pitting. That's why your team is so important. You can be a great surgeon, but if you have a bad team, you have a bad result. Also, you see how these look clumped? When the grafts are placed when they don't fit, when the grafts don't fit the sites, they create these problems of graft to site misfit, and it looks like a plug. This is a 1-session correction. This shows you the problem with a hairline that's too straight, but look at the angles. They're way too high. You drop the angles down, you pick finer hairs, and you convert a very unnatural result into one that you can't tell even close range. That's it. The course I'm running in St. Louis, I know it's a plug for it. It's really something I'm very proud of. It's 6-7 hours a day of hands-on lab where I'm literally watching you make these sites and critiquing you. I watch you do the hairline, I critique you. We've got 3D live demos where I'm actually drawing the hairline. You have 3D glasses on and you're watching me do this. You get so many lectures. And on Sunday, it's a whole day of just going through very complications, difficult cases, so that you understand how to stay safe. I'm very proud of the course. It's very intense. If you want to come, please come. It's in 3 weeks. In addition, it's only going to take 1 day off from your work. But if you have someone that you want to train as an assistant, it's not too expensive. Our assistants, we already have 49 physicians and 40 assistants. We max out about 60. So I can tell you, bring your assistant even if they've never been trained. If they're seasoned and they're great, bring them. And the way I've run this lab this year is that if you have a lot of experience, I'll let you just work on crowns with me. You can just do FUE. You can just do female hairlines. If you have no experience, I can pound you to death with that hairline until you get it and stay with the recipient sites. It's really tailored. So anyways, I appreciate your attention today, and hopefully you got something small out of that.